Good evening to you. We continue our press conferences on COVID-19 in Barbados. Yesterday evening, Barbados became one of the first countries in the independent Caribbean to receive the vaccine for COVID-19. A gift from the government and people of India. 100,000 doses of vaccine were brought by aircraft from India onto the shores of Barbados for the government and people of Barbados. We thank the government and people of India for their generosity. Some of these vaccines went on to Dominica. Others are going to be shared amongst our brothers and sisters in the Eastern Caribbean. But what is important to us is that once again Barbados recognized a first. Our vaccination program started today in the polyclinics with the public health nurses and with the Barbados Defence Force under the leadership of Major David Clark, getting all of the technical details ready and the preparations in place to conduct a wider vaccination program. There are a number of things that we want to share with you. First of all, that in addition to the doses currently on island, clearly you will recognize that there are not yet enough for the entire population, and the Prime Minister has indicated how keen the competition is amongst countries for doses of vaccination, of various types of vaccination. We have heard from various experts, and we had information today that WHO has recommended the Oxford AstraZeneca vaccine as a highly effective one and particularly suited to persons 65 years and over. And as you know, Barbados has a large senior population as well as multiple persons with one or more chronic non-communicable diseases. Two further committees have been set up. A vaccination committee under the chairmanship of Dr. Kenneth Connell, and who is a clinical pharmacologist and deputy dean with the University of the West Indies. Ms. Miriam Hines, who is in charge of the Barbados Drug Service. Dr. Ingrid Cumberbatch, who has been deeply involved in COVID-19 matters and is a senior medical officer of health with responsibility for the south of Barbados. Another representative of the University of the West Indies will be on this committee, as will, I believe, Dr. Elizabeth Ferdinand, who has been coordinator of the national committee. And that group is going to be examining the various types of vaccine available across the globe and making determinations as to which ones are best for us and when, in fact, we should pursue them. You may have heard on this program before, on a previous press conference, that Oxford AstraZeneca is particularly well suited, not just for the age groups whom I have just identified, but are well suited within the context of our climate. You know that the Pfizer requires storage at either minus 70 or minus 80 degrees, but this vaccine, the Oxford AstraZeneca, can be stored in a refrigerator and in regular refrigeration conditions, and in fact went yesterday to storage. Senior health sister Rosanette Cook has responsibility for the storage and safety and preservation of the vaccine while it is on island before all doses are utilized. There will be a second committee that will look at persons 18 to 70 years old in Barbados who have chronic non-communicable diseases. This is a particular problem in our national health profile, and we will speak to these committees in the future. But today, joining us in alphabetical order are Dr. Anton Bess, Senior Medical Officer of Health, Major David Clark of the Barbados Defence Force, and Dr. Elizabeth Ferdinand returns as national coordinator of the vaccine program. We are going to start today with our dashboard, which is going to be presented by Dr. Anton Best. He is going to talk about the numbers available to us today. And of course, you know that they relate to yesterday because that is how the dashboard is structured. And he will speak in particular about the dashboard of the day before, which showed 82 positive cases and caused a high degree of consternation. So we'll start with Dr. Best, who is going to talk to us about where the numbers are, what the implications of that are, and how we are doing. Dr. Anton Best, Senior Medical Officer.
Thank you, Ambassador Thompson, and good afternoon to all viewers, all persons in Barbados. It's a pleasure to be here and to share with you an update on the COVID-19 situation in Barbados. So on February 9th, the Public Health Lab conducted 315 COVID tests, and of those tests, 43 persons were diagnosed as newly positive with COVID, and that included 20 males and 23 females. So this brings to a total 1,857 persons diagnosed with COVID since March of last year. Unfortunately, we've had 20 deaths in total, but no deaths were recorded for February 9th. The total number of persons who have recovered is 1,504, so there are 333 active cases of COVID in Barbados, and those persons are in isolation. Ambassador Thompson, you mentioned about the dashboard for the previous day, and I wanted to reiterate that it did in fact cause a huge stir, because the assumption is that when we reported 82 cases for February 8th, the assumption that a lot of people made is that 82 persons were tested and diagnosed on the same day. However, when we took a deep look at the data, what we realized is that those 82 cases were diagnosed over an 11-day span. So starting on the 29th, we had 4 cases. We went as high as the 29th of January, that is. We went as high as 19 cases on the 3rd of February and as low as 0 cases on the 7th of February. But that was 82 cases reported on one day, not 82 cases diagnosed the same day and tested the same day. So no cause for alarm in terms of the high rate of cases that was reported yesterday.
I'm sure that a lot of people are going to sleep a little more comfortably having heard your explanation. I must tell you that I received numerous telephone calls and WhatsApp messages, and one lady in particular said, look, this thing just traumatized me. And I'm sure that that is true of a lot of people. Yesterday, people were traumatized. The number appeared just to be so totally out of whack with everything, but I'm glad you've explained it. It was the number recorded over a particular period and not for any single day. Thank you so much. So thank you for sharing the information. I go on then to Barbados has recorded 1,857 confirmed cases, 786 of whom are female, 1,071 are male, and 1,504 persons have recovered. There have been 20 deaths from this viral illness. The Public Health Laboratory has so far conducted, waiting for the number, 109,146 tests. So, the vaccine is here. We are in a good position by comparison with many populations across the world. We are positioning ourselves for protecting our public and boosting our economy. A protected public is the first step to a vibrant and fully open economy. And here to explain to us how the vaccine or the vaccination program will be rolled out are Major David Clark and Dr. Elizabeth Ferdinand, who are the coordinators of the national vaccination program. Dr. Ferdinand was here before and spoke in her capacity responsibility for medical matters relating to the vaccination program, and Major Clark has been responsible for logistics. We will start with him. Major Clark, the vaccination is here, the vaccine is here. Can you tell us, you started today with the public health nurses and in the polyclinic system trying to ensure that everything was working correctly. Can you explain to us, please, how the program is going to be rolled out, what the details on the organization are, how it will be distributed, how are people going to get it, who is going to get it? Major Clark of the Barbados Defense Force.
Thank you, Ambassador Thompson, and good evening, Barbados. The vaccination program is going to be rolled out via the excellent public health system we have. We have 9 polyclinics based in Barbados, and we will be rolling out the program piggybacking on those polyclinics. So we will have a number of teams operating out of those polyclinics. Every polyclinic has a senior health sister who manages the system. And what we have done is we have capacity built that so that we can have vaccination teams at the polyclinic. We can have satellite teams. We can have mobile teams. We can have drive-through teams. And we will have a static team. And it's going to be very much based on where the population is based. We also have different categories of people to be vaccinated. Of course, we must first show our governance structure. So we will be looking at how our governance structure, our politicians, our parliamentarians, our cabinet, if they're not in good health, then the economy wouldn't function. We must also look at our safety and security. And we will be rolling out with the Barbados Defense Force, the police, all those frontline workers that are essential for the function of our economy. So we have asked all the organizations to actually present us the numbers of people in those organizations. I must say that in the first round, and we do have several categories, so a category 1, 2, 3, if you are in an organization and you are presently suffer with COVID, of course you cannot receive the vaccine at this time. You will drop down to the next category. So we will only be vaccinating those people who have not had COVID or are not showing any symptoms at this time. So certainly rolling out with all the frontline workers, and that would also include all the people dealing with supermarkets and other things like that in terms of making our economy work. I hope that gives you the outline of the program. In order to us to do that, people like dentists, in order to help the dentists, we have come up with a structure because we only have a certain number of vaccines at this point in time, but we have to be able to spread that vaccine to shore up our population. And as more vaccines come, then we'll be able to do more and more people in different tiers.
Can you tell us a little bit, you spoke about drive-in teams, static teams, and a number of teams. How are these teams made up? And can you explain a little bit about where the vaccine is going to be administered? The static teams, the drive-in teams, where is it all going to be done and how?
The teams are comprised of 9 persons, and each team is managed by a public health sister. Legally in Barbados, only a public health sister can sign off on your vaccination. So the teams are managed by a public health sister, and we may have 2 sisters in the team and a staff nurse or a nursing assistant. We will then also have a medical doctor who is there to make sure that you're educated on the process and also to manage you, because after you receive your vaccine, there's a mandatory 15-minute period in which you have to wait and you have to be observed. And so each team has to have a full medical team with an emergency tray and oxygen and a medical doctor. We will also have, of course, a general worker because we have to be sanitizing after every individual has been vaccinated. and of course somebody to manage the flow of patients coming in, as well as a person to sanitize you at the beginning. So the process starts with you being sanitized to enter, becoming registered, so we have a medical records person, a file is open, you then go to get your vaccination, and finally when that is done, your information is entered into SHAPE app. And so since I have actually got my vaccination, once you have got your vaccination, you actually receive a card very similar to this one, which I got my vaccination today as we were testing the system. And also, there's a SHAPE app managed by students of the University of the West Indies. And after you receive your vaccination, they enter your information and they actually email you the same information. It also has your return date when you should come back in 4 weeks' time to receive your second dose. That's the system in its basic format. In terms of the teams, there will be static stations at the polyclinics, and so you will do your usual system in the polyclinic, but we have reproduced that system so that it can be used in mobile teams. Excuse me. And of course, as each team is comprised of 9 people, so a mobile team can come to any location, and they can actually provide you with the same full services. The teams are outfitted with all the digital tools necessary. Each team has 3 laptops and the emergency equipment, and so they can do it in a mobile location. We will have drive-through teams where you stay in your vehicle, and as you drive up, you go through the same process. You get sanitized, you get registered, you get your vaccination, you get your SHAPE app, and then you have your observation for 15 minutes. We have a static location, so they're based on population density. When we look at where people live, we will create, where there's no polyclinic within that area, we would create, so in Checker Hall, St. Lucie, we will create a static clinic where people can walk into the clinic and go through the same process. So I think we've been able to piggyback on our excellent healthcare system and to use that system in many different ways.
Can an individual just turn up and say, well, I come here all the time, look me here?
No, not at this time. As I said, we have several different categories. The first category of frontline workers, we will be rolling that out in the next couple of days. Certainly Barbados Defence Force, the police force, all the healthcare workers, the Queen Elizabeth Hospital. What we have done is we have looked at organizations that can also facilitate their own vaccination process, and we have capacity build those organizations. So an organization like the QEH will be managing their process. The Barbados Defence Force, which has its own medical facility, will be supported from the Winston Scott Polyclinic to actually vaccinate their people. In terms of the drive-thrus, as the program ramps up, we can have drive-thru stations at the Globe Cinema. You can have the Grantley Adams Polyclinic, the Grantley Adams International Airport, the Clock Tower by the Garrison, and of course, as we get more, we can add. We also have schools and other locations that we have made satellite vaccination centers.
Her Excellency Dame Sandra Mason is doing well. Prime Minister reported an incident where she had gone in, Her Excellency had gone into isolation perhaps a week or more ago now. She has been fully tested, is doing fine. Her tests are all negative, and Her Excellency will be taking the vaccination publicly. So we are going to get to see Dame Sandra Mason, Barbados' Governor General, being vaccinated. Dr. Ferdinand, tell us a little bit more about the medical program, and then we will go to our press.
Good evening, Ambassador, and good evening, Barbados. I'm here again. It's getting to be like a recurrent decimal, but it's necessary. So we're asking, Ambassadors asked me about the medical process. Well, the medical process is such that the vaccine has come in a 10-dose vial, and each dose is comprised of half a mil or 0.5 mils, and the nurse will draw that up and will inject, as I said before, into the deltoid muscle of your arm here. And I've just had mine about 2 hours ago. So far, so good. But I'm hoping that we'll be able to have a picture of myself, the CMO, and Major Clark receiving our vaccines today. But you'll have that then, and as Major Clark has already gone through the process, but medically wise, that's what you're going to have, and you will wait until 15 minutes after you've had the vaccine before you're free to go home.
Thank you. Joining us by Zoom are Barry Aline of The Nation News, Randroom of CBC, Marlon Madden of Barbados Today, and Michael Phillips of The Advocate. Gentlemen.
One question for the Major and one for Ambassador Thompson. Major Clark, can you give us the early numbers with regard to how many people were actually vaccinated today, and how soon do you expect our national security personnel in terms of police, BDF personnel, etc., how soon you expect they to actually be inoculated?
Thank you very much. We vaccinated about approximately 30 people today. In the teams I mentioned, there are 9 people per team, and in each team, there's also a university student. And the university students are using a SHAPE app, which is a new app on a laptop computer. And so we had to trial that because that is not normally part of the public health system. So with the students and my team and Dr. Ferdinand's team, we actually tried it to see how the system worked and any glitches so we can actually iron those out. Tomorrow morning, we will also be doing a remote team because we were in a polyclinic, which is already linked into the MedData system. As you're aware, everybody who goes to a polyclinic has a record into the medical data. This is the first time that we're going to be trying to add your medical data remotely from a location. So if we create a center in St. Lucie, we're going to be using Wi-Fi to upload your data into the MedData system. And this is the first time we'll be doing that. So we will try that. In terms of we are going to try this again tomorrow with the small BDF medical team. And certainly in the next day, we'll be rolling it out across with the BDF. They will be doing their vaccinations at the BDF headquarters. And we expect to get through the entire BDF before Monday. And certainly the police, the way the police structure is, they go to the polyclinic base within their divisions, where Barbados is divided into different police divisions. And so they will go to the polyclinic in their divisions. So certainly in a day or two, we'll be rolling out. We also have to look at our table of precedents and the governance structure. And we will be starting tomorrow with some of those people on the table of precedence. So I believe you probably will be invited to observe that, but we will certainly be starting tomorrow. Maybe on a small scale, but by Monday we'll definitely be at full capacity. If I can also mention, we will have 27 actually teams who can be out working in different facilities.
So, Major, the 30% vaccinated today, were they all public health officials?
30 people vaccinated were University of the West Indies students, public health persons, my small management team from the BDF, and Dr. Ferdinand and the Chief Medical Officer.
Thank you. And question for Ambassador Thompson.
Yes, sir.
Yes, Ambassador, good news about the Governor General. Can you give us an update on the Chief Justice, and can you tell us how soon you would expect to have this public vaccination where the people of Barbados can see these particular persons receiving their vaccines?
I'm going to defer to Major Clark, who is really handling the organization of it. I'm going to do like you and just turn up as a spectator to see this very important event, but I'm not myself in a position to say that. I believe that Dame Sandra get her soon. She communicated directly with me. I was to speak to His Lordship, the Chief Justice, today, but didn't. So I cannot report today, but when last I spoke to him a few days ago, he was fine. I can try to reach him while we're waiting. So I'm going to ask Major Clark to give us some indication of when these various personages will be done. I'm also going to ask Major Clark, you spoke about the Defense Force personnel, you spoke about the Royal Barbados Police Force, Queen Elizabeth Hospital, the various health institutions. What sort of numbers are we talking about? Because this must run into the thousands.
Yes, we're talking of over 20,000 people in the frontline workers alone. Certainly, the numbers, we have had to look at the numbers, and we've restricted them so that every entity can function. And so we couldn't give everybody in every entity. So if you're not a frontline worker, if you're in the back office and you're not being exposed to the general public, then you're in the second round as opposed to the first round. So in terms of frontline officers are first in the queue, and then the other officers who may do jobs that don't expose them to the public are in the second round. In terms of the governance structure, including government cabinet, we're in a position to start that tomorrow, probably here at LR Court. That has to be confirmed. And once that is confirmed, I'm sure that you will be made aware so that the media can come and observe the process.
Thank you. Did you say that the Governor General has received a negative second test?
Yes, the Governor General has indicated that she is perfectly fine.
Thank you.
Ryan Broom here from CBC. Question for Ambassador Thompson or Dr. Best. In terms of the seek and save, the intention was originally to seek out some people in the community who were potentially ill or showing symptoms. What have those results shown? Are there people who are potentially positive that you found so far in the field, and what are those numbers looking like?
Sure. Thank you for the question, Mr. Brooms. So with the Seek and Save campaign, up until yesterday, we identified just over 200 households, which equated to about 236 persons that were symptomatic, possibly symptomatic of COVID. When we dug deeper, we decided to only conduct tests on those who had symptoms, let's say definitely in keeping with COVID, because the initial evaluation would not have been specific enough. We conducted 105 rapid tests as well as standard tests that have been sent to the lab. Out of the 105 rapid tests, 5 have been positive. And those 5 were diagnosed yesterday. I don't have data for today as yet. When those 5 persons were diagnosed, they were informed, and they're being transported to isolation facility at Black Mangala.
Okay, and another question kind of related. In the numbers that can you confirm any reports that I'm having here of children being included in some of the positive cases that are among the active cases right now? And if so, how many?
Unfortunately, I don't have data on the number of children who are active cases right now.
But are children among the numbers at all, to your knowledge?
Ambassador Thompson's indicated that she's going to try to reach Dr. Ford, who's in charge of the isolation facilities, to get that information.
But we know that children have been in the isolation facilities in the past. There's a view that only elderly or people with chronic non-communicable diseases, but children, young people, and to all intents and purposes, people who we think are perfectly healthy and are in fact perfectly healthy, are coming down with COVID. Is this not so, Dr. Best? Because I would appreciate it, please, if you could speak to this, because only this morning a member of the media contacted and indicated a concern that the focus has been on trying to caution those who have chronic non-communicable diseases to be careful, or for persons with elderly family members to take particular care with them, but they were not hearing enough about young, healthy persons. So tell us a bit as to whether these persons are also being affected by and infected with COVID in Barbados, please. Thank
you for the question. So the fact remains that COVID is affecting everyone all across society. We have been placing specific emphasis on those who are vulnerable, so persons over the age of 60, persons with comorbidities such as diabetes or hypertension or renal disease, because those persons have worse outcomes. That doesn't mean, however, we're focusing exclusively on them, because if you only focus exclusively on them, we're not going to break the chain of transmission. So we also focus on young people who are vulnerable from the point of view that they can get infected with COVID and transmit it to those persons who are vulnerable, who are more vulnerable, such as their parents, such as their grandparents, and elderly folks in the household or in the community. So it's an important message that children and young people are still vulnerable. They're still part of the problem and part of the solution in terms of breaking transmission chains across Barbados.
Drive-through testing. I heard Ambassador Thompson speak of the drive-through vaccinations. Are there any plans to include drive-through testing to kind of bolster what is already in place in terms of at the gymnasium, et cetera, in terms of the testing process?
So in terms of drive-through testing, it's something that we have thought about in the Ministry of Health. Logistically speaking, it would be very challenging, and right now it is probably not necessary because we have adequate number of testing sites. We have mobile teams as well that go to persons that can't get to the the testing sites across the island, whether it's at the gymnasium or one of the polyclinics that are offering COVID testing.
Today, Major Clark mentioned that we have 3 categories, but I heard him spoke of one with the frontline workers. What are the other 2 categories of people to be vaccinated?
Actually, about 5 different categories, and I don't have them with me on paper at present, but we are still refining categories because, as you can, Barbados has a rather large elderly population. And so when we looked at the numbers of people, and we looked at the WHO guidelines as to people over 70 years old to vaccinate, they actually 21,000 people over 85 years old and 44,000 people over 75 years old. And so it is also important that we also look at people who have medical issues, chronic non-communicable diseases. And I gather from the medical professionals that we have about 30% of our population of those. So in terms of servicing all of these categories, and we probably have, I think it's 5 categories, we then have to make sure that we service the ones who really need to stop the transmission and to make sure they don't get extremely ill. So people who have issues, and this is probably better answered by Dr. Ferdinand, but certainly when we look at the categories, we're trying that people who get ill will not get severely ill, and also we're trying to stop this transmission spread. And so we have been looking at the numbers of people and the different categories. So there are about 5 categories in all. I spoke about the first category, which we are rolling out now, which will be our healthcare professionals, our security people, the governance structure in the country, the people, the frontline workers, supermarket workers, taxi drivers, port health workers. So there are probably 200 different categories of workers that we have gone through. So we have spent lots of time looking at the people that we need to run this country and how we can help them so that this country can function. Because we cannot allow the country to be shut down for a very long time. Certainly we've got to be able to make sure that people can work and also get our society back up and running. I hope that answers your question.
Yes, I have a follow-up question though. Could you say what the current population size is in Barbados and how many people then we would be seeking to target overall? And if you could say that if the operation Seek and Save would help us to identify this number.
Certainly. What we have actually done is we have actually looked at our electoral boundaries and where people live and the numbers, and also, so in my operational command center, I can actually show you all the people over 75 in all the different areas, all the people over 65 in all the different areas, all the people over 95. And so certainly when we design our rollout campaign, it's really designed to service those elderly people and the people who really need to be shored up in terms of vulnerable people with non-communicable diseases and those things. So what we have done is taken an evidence-based approach to how we actually design and roll out the vaccination program.
We have two questions from, I'm assuming, medical practitioners. So they will be addressed to Doctors Best and Ferdinand. Good afternoon. Will the private practitioners be able to give the vaccine to dispense to their patients? That was the first one. And the second one is, this question is for one of the doctors. If we are administering 2 doses of the vaccine and a person does not take the second dose within the suggested time frame, will the individual be required to start the process over, as in the case of the hepatitis B, I believe that is, vaccine? And my question to that, which adds to this, is what is the time frame within which the 2 doses are being administered?
Okay, the first question is no. The answer is no. The time frame, as you've asked, Ambassador, we are hoping that within 3 months of the first dose, they will be able to have taken their second. There are going to be some people who will not come for the second. That's how history runs in any vaccine. So those people, if they want to come and get a second dose, well, depending on how much vaccine we have. If we have excess vaccine after we've been able to do everyone in Barbados who wants it and who needs it, then we will give it to them. As far as I know, as this is a new vaccine again, we're not sure how long the immunity will last, but whatever it is, if they need another dose in 6 months, they will get it, once we have enough for everybody. And the first question was about the private practitioners giving their patients. At the moment, the answer is no, I'm afraid. We can't do it like they do in the UK. So we're trying to do it as best we can, as Major Clark said, through the polyclinics. We are going to have 1 or 2 practitioners' offices who have offered their office for us to be able to use it for the public to come and get the free vaccine. And we're working with them as to which days they will be open so that their patients or people around can come to their facilities. We're working on those too. But generally speaking, no, because of the infrastructure that we would have to take. You have to have the medical program and the information, the medical clerk to enter the data. You've got to have the public health nurse to do the injection. So, you've got to have the shape app. Yes, they got to have the shape app to do the recording of the certificate. So, I mean,
At least to monitor after.
yes, well, if there's a private office, I suppose they would have those facilities, or they should have. But generally speaking, for this first round, we're not entertaining really every single private practitioner being able to inject their own patients. We would, however, like them to advise their patients to have the vaccine if they need it.
But I know that some 55 doctors or thereabout are helping to support the program within the polyclinic system.
What we have done is we've been very in good relationship with the BAMP organization, and actually right now, or they should be finished by now, we were doing a training session. Dr. Omar Edwards, who was here the other night, he has been doing a training session with the doctors who volunteered to work with us, and they've all been allocated to the different polyclinics, and hopefully will be able to give us some time to be present as part of the team.
Ambassador, if you permit me to say something on the training program. Medical people who had to be trained, but we also had the university students who had training. So we had training programs for medical professionals. We had training programs that included the data record people, and we had training programs that include the university students. So we have been running a series of training programs for all of the people that make up the composition of the teams. Thank you.
Mr. Aline, I think you were asking a question?
Yes, I have a question for Dr. Best. Dr. Best, I'm not sure how deep into analytics you are, but maybe you can help us here. If you take a cursory look at the numbers you presented not too long ago regarding Operation Seek and Save, 200 households touched, 230 persons believed to be asymptomatic, 105 rapid tests done, and from those tests, 5 positive cases. In a country that is dealing with community spread as Barbados is, how do you extrapolate those numbers? As a public health official, can they give you an early indication as to what we are facing and how widespread or community spread may be?
Thanks a lot for the question, Barry. What I did not explain or I did not state was the number of households actually reached by the university teams who are sending out student evaluators to the households. So that is the universe that we're dealing with here. So out of the approximately 90,000, 100,000 households in Barbados, I don't have the recent data as to how many households they've reached. I know up until a few days ago, that number was close to 15,000. What I gave you were the number of cases that they flagged. And when I say flag, the questionnaire asks questions about symptoms and signs in keeping with both dengue and COVID. So what we do is we filter, and then the team that does the outreach part of it, led by Dr. David Beyer, they do a telephone triage. So they call the numbers and say, you reported these symptoms as part of this study. Could you please elaborate a little bit more? So we want to find out if indeed that the headaches they had were new, if indeed that the cough that they had was within the last week or two. And in some cases, you'll find out that somebody had a chronic cough related to sinusitis. So we whittled down those numbers to 206 households and 206 households, 236 persons of interest for testing. So we've only done a portion of those that we've identified for testing and that have agreed to be tested by the teams that come out. We cannot, at this point, use this data to extrapolate. What we can do is to use these data in collaboration with the other data that we present on an almost daily basis to get a better understanding as to where we are. So you mentioned that we're having widespread transmission, and we are having widespread transmission across Barbados. The Seek and Save campaign is not the only strategy that the Ministry of Health and the government of Barbados is using to address COVID-19.
As an early indicator, these numbers wouldn't raise your red flags, though, would they? Or you're not in a position to say?
No, the numbers aren't raising any red flags. I believe that the project so far is successful in terms of reaching many households. And we will continue testing. We will continue the outreach component as we try to identify persons who are potentially COVID positive. Once we do the testing and they're diagnosed with COVID, we isolate them. We start the contact tracing effort.
Just to revisit the numbers issue again, when we started, you had referred to the 82 cases that had been publicized yesterday, I believe it was, and you'd said that the span, I believe, was between sometime in late January and early February. I think you said to the 3rd, and I want to kind of juxtapose that on in conjunction with something that the minister would have mentioned in terms of trying to keep the positivity rate below 5%. Now, clearly there's still a lag in terms of tests and results. And is it reasonable to say that we can't truly assess from the lockdown period, the start of the lockdown period until now, what that positivity rate really is, based on the fact that a lot of these results are really only up until the actual start of the lockdown.
Mr. Brooms asked an excellent question. What I can explain to you, what I can say to you is that we have a backlog at the lab. So we had a backlog at the beginning of the year that we started to reduce, and we got the backlog erased, but then another backlog started. And part of the reason for that is because we have a serious problem with reagents. When we do a PCR test for COVID, we have to go through a process of extraction. There are two ways to do it. You could either do a manual extraction or you can do an automated extraction. We have the automated extractor, but it needs a reagent. Reagent that we ordered many months ago and that we've made many orders of and we've been trying to procure for Barbados has not been obtained as yet. We keep hoping that we're going to get it, but the reality of the situation is that the demand is high and Barbados is fighting in a global market for very limited reagent. So what we do at the Best of Santos lab is we have to resort to manual extraction, and this delays the process. So that is why we have this problem with the backlog, and this is why we have this problem in terms of the 82 cases that we reported. I need to correct you. The 82 cases that I mentioned earlier that was talked about yesterday in the dashboard was over an 11-day span from the 29th of January till the 8th of February, 11 days. So we're going to have that because we simply can't do all of the tests that we receive because of the issues that we are currently having. You also asked about positivity rate. So positivity rate is one of the key indicators to know how well a country is doing in terms of its COVID response. The positivity rate, very simply, is the proportion of tests that are done that are positive. The benchmark that countries typically use is about 5%. So once you're under 5%, you're doing pretty okay in terms of positivity rate. If you're over 5%, you're not doing so great. What we want to see is a reduction in the positivity rate in Barbados as one of the indicators, not the sole indicator, but one of the indicators to say, yes, our interventions are working. We need to continue certain interventions, and other interventions we can ease off on. What is hampering our ability to do that, unfortunately, is the lack of lab reagent and the lack of timely lab results. It is very difficult to do it, so we can't do it in a real-time manner. But thank you very much for your question. It is something that we're grappling with at the Ministry of Health.
Hi, good evening. This is Michael Phillips from the Barbados Advocate. Very quickly, trying to find out, in the event that you do take the vaccine and you contract COVID between your first job and your second job, what is the operation there? Do you go back earlier time, your scheduled time for your second job? How do you go about that?
Usually, if you are going to be ill or you've had COVID, you must have a period of at least 4 weeks after you recover from the COVID illness before you can actually have another vaccine, right? So, and that patient would have to be monitored because, you know, they've had a vaccine, it's failed, and now they've come down with the COVID. We really would need to look at that, maybe the strain that that he had or she had, and definitely monitor that patient. But we won't just rush in and give the same vaccine again.
The question is, we're here on Zoom and we're on CBC TV and YouTube and many other outlets, but everybody does not have access to these. What else, if anything, is being done by the government to sensitize persons about the vaccination rollout?
We are working also with the government information services, and there's been a series of frequently asked questions that have been developed, which I'm hoping will soon be available in the media. We are hoping also to have announcements to go on radio, which the announcers could say from time to time. Okay, and just this evening, I was listening to one which we're asking people to probably register for their vaccine if they're over 70. So these are the kind of things that we are hoping to do. We're also trying to send a message through Digicel and Flow to people's phones, for those who have phones, giving them messages of what to do.
Utilizing traditional and non-traditional media, the FAQs will be ready for dissemination by Friday. We are using public service announcements. The media is mobilized. We are using WhatsApp messaging. We are using community leaders. We are using influencers. We are having television messages. The persons engaged in this process have been doing a number of television programs. We have disseminated and are continuing to disseminate short videos and infomercials. We have done audio messaging. We have really tried to utilize both the traditional and the non-traditional media, or the new media, as some people call it. We have Facebook, we are using Instagram, we are using Twitter. Every medium is being engaged so that we have maximum coverage with information. I think that we are going to have to start going to the call-in programs as well, but we really have tried very hard to use every forum available to get the information out there. And you will appreciate that we just got the vaccines yesterday, and that there's going to be a little lag time as the policy is fully worked out. I just want to also indicate, I made sent a WhatsApp and have ascertained that to date, 37,034 households have been completed in the household survey for the Seek and Save program. 37,034 households were completed. Today was a rest day for the teams. They will resume again tomorrow.
Question for Dr. Ferdinand. Dr. Ferdinand, there has been some concern with regard to the efficacy of AstraZeneca in persons over 64 years old. Now that Barbados does have AstraZeneca and we will be inoculating persons over 64 years old, will we be carrying out our own efficacy trials as to if AstraZeneca does or does not work among our elderly population?
Well, as far as I'm aware, the university is supposed to be looking at doing such a study. And hopefully they will come up with some type of answer. But we have to look at the number of cases and the severity of those cases in the over 65s that will occur after we've done our rounds of vaccination. So it's a trial and error in a sense, but that's how I think the old traditional way. Yes, we're going to hopefully be able to get some scientific evidence, but we will look at the figures post-vaccination.
Just to indicate that we sent. Go ahead, Mr. Madden.
You mentioned earlier that we have two committees. I think you said one was set up. The first one you mentioned about they're supposed to be looking at the types of vaccines available, when, and so forth. With this in mind then, and we receive the AstraZeneca vaccine, wouldn't this then be somewhat putting the horse before the cart, or the cart before the horse, sorry?
The AstraZeneca vaccine, Oxford AstraZeneca vaccine, which is now recommended by WHO for elderly populations. There was some information sent out by WHO within the last day or two as to whether it should be used against the various perhaps I should just read from it. The WHO also says the vaccine can be used in people aged over 65. And it went on to say why the Oxford AstraZeneca is suitable and so on. And I did disseminate that via WhatsApp and to the media over the course of today, because that's when the information came in. In relation to whether we're putting, I don't know if cart before the horse really is sort of the correct expression, but I think I do understand what you mean. We've gotten vaccine. We've gotten vaccine from one of the world's largest producers of vaccines. It is a respected, reliable vaccine recommended by the World Health Organization. It is suitable to tropical climates because it is easier to store than those that require deep sub-zero temperatures. Therefore, that is the vaccine with which we are going at this time. Our efforts, the Prime Minister has indicated that day and night she is consumed on this effort in the competition of the global marketplace, where Barbados is a small island developing state with a tiny population. A population that is the size of a small town in the United States, when there are countries with wealth and power and large populations getting vaccination or getting vaccine products, and they can order. The EU can order millions of vaccines. Africa can order millions of vaccines. Other countries that have populations that run into the tens or the hundreds of millions can order large doses of vaccine. And where there is a limited product and you are a manufacturer or a vendor, it means that you have power in the marketplace and you can determine who you sell to, when you sell, and how much. And therefore, now that we have the Oxford AstraZeneca, which is a high-quality vaccine with high efficacy, suited to our climatic conditions and to our population or demographic profile, the effort is continuing to ensure that we have other vaccines because there are different types on the market. This committee will determine suitability and other related issues from a medical and logistical perspective and make recommendations to the government. There will also be issues relative to pricing considerations, availability to us, because just because a vaccine is in the market, it doesn't mean that it is best suited to our conditions or that it is available to us for purchase. This committee of technical professionals, Dr. Kenneth Connell, who is a clinical pharmacologist and deputy dean with the University of the West Indies, Ms. Miriam Hines, who is responsible for the Barbados Drug Service. These are specialists, Dr. Ingrid Cumberbatch, the immunologist or virologist from the University of the West Indies, Dr. Ferdinand and others. They will guide government on the future choice. But I do not think that if we had an opportunity to get vaccine and protect our frontline workers, the medical professionals, the Barbados Defense Force, the Royal Barbados Police Force, the nurses, those persons who are on the front line in every way, fighting to keep this country stable in the context of a global pandemic where health systems are buckling under the pressure, and ours is still standing. Yes, there have been challenges, but really, we have not suffered in the way that many countries and many populations across the world have suffered. And it is in that context of the keenest competition in a global crisis that this committee is now being established to ensure that we get more vaccination product, or more vaccine product, or more vaccine, whichever is the correct language, for our populations. So I don't think that we have put cart either before the horse, or the horse has bolted from the stables. I think that we are riding to protection of our populations in this matter in the best way we can. I mean, let's face it, given our population size, Barbados just became the first country in the world to start I beg your pardon, the first country in the independent Caribbean to start a vaccination program and to roll it out tomorrow. I think that in itself is pretty amazing.
Mr. Thompson, the Prime Minister last night spoke to eventual negotiation for another batch of 100,000 vaccines of Covishield. Is government in a position to give an approximate cost? What will this cost Barbados, this 100,000 vaccine batch, when we do have to pay for it?
So when we know how many we are getting, where we are getting them from, and which vaccine, we will make the price available. But let's say that whatever the Prime Minister wants Barbadians protected, she is going out of her way to ensure it happens. She's been able to negotiate and get some free vaccine, but whatever the market demands, we're going to have to pay. But that is a price that we are willing to pay to ensure that Barbadians are safe and protected and that our economy can fully open up again. You know, people say close the borders, lockdown, and then they don't like what lockdown really means. And then everybody wants more money, but foreign exchange isn't coming in. It's a horrible position to be in at this time, I think, for somebody who has to make those choices. Can't please everybody. Yes,
Ambassador, if you
Major
permit
Clark.
me, in the categories of workers that I talked about, of course, we have the frontline workers, and I didn't drill down to say that if you look at the red caps at the airport, the immigration, the customs, the people at the hotels who work at the quarantine hotels. So we have created the list in category 1 of all of our frontline workers. We have had the private sector organization tell us the supermarket workers, the gas station attendants. So in the first round of vaccinations, we will also be rolling it out so that all the people that allow this country to function will be getting some form of vaccine.
I'd be happy if you would repeat that, because you know I heard some what we ordinary Barbadians in there, those really who have been fighting, supermarket workers.
Supermarket workers, gas station attendants, the red caps at the airport, the immigration officers, the customs officers, the seaport workers. Obviously, we cannot function with those. So the people who actually make the country work, if you can't put in gas in your vehicle, then or petrol, you can't do anything. If the bakers don't go, certainly if you arrive at the airport and there are no customs officers, no immigration officers, the welcome people who meet you at the airport, the people who load the aircrafts. So certainly in the first round of vaccinations, we will be vaccinating lots of frontline workers. I think there are so many categories of workers that we have to vaccinate in order to make us work. So we're not only doing the healthcare professionals and the security people, we're doing the people who actually make the country work, all of the frontline workers. And that would include the dentists, the people that you need to do things. So what we have done is all the different professions, jobs that come under all the ministries, we have looked at them and we have asked them to look at the numbers of people under all those ministries so that we can come up with a figure in our first round.
Did you say that you've seen any reluctance at all from any of the forces the security forces that have been approached so far, and then know that they're to be vaccinated? Any reluctance at all, or everybody's on board?
I have not personally seen it myself. I've heard people saying that it is, but I don't think that may be as real as I think. All the people who have been offered so far have taken it. Some people have actually said no, they wouldn't take it at this point in time, and it's really their choice because it's their voluntary choice. Some people like to wait and see what's happened. I mean, I took it today, and the effects, I don't have any effects as yet, so we'll see. If you see me around, you know that nothing happened. But certainly, all of my team that worked with me who were offered it, and they took it. So certainly, I believe people, once they understand the science behind it and listen to the health care professionals, I believe people will be taking it. But I think certainly I took it, and the doctors told me I might have some soreness in the arm and some redness of the arm and some swelling, and I have not had that as yet. So I will see tomorrow morning.
I have a question for Dr. Ferdinand or Dr. Best. In Barbados, there continues to be a level of concern and confusion among members of the public with regards to the vaccine. We keep hearing about immunity and herd immunity, with a particular percentage of the population needed to be vaccinated to achieve this. And correct me if I'm wrong, and we hear that the vaccine does not protect persons from contracting the disease, the virus, or passing it on. Instead, it protects persons from becoming gravely ill and dying. Can you explain how herd immunity is achieved if it doesn't stop you from getting or passing on the virus, sorry?
Okay, well, let's look at the whole population of the country. The less people you have in it that are infectious or are able to pass the infection on to somebody else, the better. You agree with that? So, if you immunize and the people are not ill or they're not as ill, a person going around coughing, and not using anything, spreading all the germs around, in a simple way, if they're not coughing as much and they're not spreading as much, they will be less infectious. So hopefully, all the people who come in contact with that person would not get infected. All right, maybe 1 versus 10. We don't know, right? So there's a certain amount of level, when you talk about herd immunity as well, there's a certain percentage of people that you have to have non-infectious to be able to say that you have herd immunity, so that the infection rate is much, much less. You're looking skeptical. Does that answer what you...
I guess it answers the question, but like you said, less infectious, but you can still pass on the virus though.
In small, maybe in less, less reduced, a reduced pass on. And you've got to think also is, we want to save lives, and we want to also save the morbidity, the amount of illness. A person gets sick and is home for 2 weeks sick with the flu or with the COVID, right? That's 2 weeks lost to their work, to their family, to their school, or whatever it is they do. And that's 2 weeks. I'm just saying 2 weeks. It might be 3 weeks, 4 weeks, who knows, right? But at least they're not dead. So if we can reduce the amount of time, say it's a week, far less worse than 2 weeks. So that's why we think that the vaccine is worth it. We still, however, and I want to stress this, we still have to continue to do our social distancing, our mask wearing, and our hand washing and hygiene. And until we get rid of it altogether, we're going to have to continue to do that. I had to put in a plug for that.
Sorry, Ambassador. Yes, please. If I may add. So there was a question about the efficacy of the vaccine. When the vaccine trials were first announced in terms of the results, the trials were designed in such a way that they were looking for the disease. So what they found was that persons who got the vaccine had less disease. So it had less severe disease, which is what you're talking about. However, within the last few days only, within the last week, the AstraZeneca study investigators have proven that not only is there less disease if you've taken the Oxford AstraZeneca vaccine, but there's less infection as well. Right? So that is one of the contributors to herd immunity. The vaccine will work in reducing transmission.
I think there's another component to it, if I may, and Dr. Best and Dr. Ferdinand can tell me if I'm right or wrong. The more people who become gravely ill, the more we put our frontline people at risk. The more people who become gravely ill, the more people have to come into the healthcare system to be treated. the more people who we are treating for COVID and COVID-related illness, the more likely your healthcare system is likely to become stretched and overwhelmed. That has implications for the treatment and care of non-COVID related infections and diseases and conditions. Certainly when I was in New York and, I was following the news and reading upon it constantly, one of the studies showed that persons with non-COVID related illness were far more likely to die or not get excellent care because hospital personnel, healthcare workers, were so consumed by the huge numbers with severe COVID disease. And in the United States, so many healthcare professionals were themselves coming down with illness from being exposed on the front line. And I think that is another argument for why it makes good sense to take the vaccine. But the doctors might wish to say yea or nay, and I mean, I might be entirely wrong. So feel free to say so. I won't.
I think you're absolutely correct. There's nothing more that I need to add to what you've just stated, so thank you.
I believe this is Mr. Michael Phillips of The Advocate. Yes, who was just speaking. I'm trying to associate the name and a face.
Yes, please. That was me.
Yes, thank you. Okay, so we're going to wrap up unless there are any other questions.
Just a reminder for me, could you remind us what the percentage of the population or the number of people that we're seeking to get in order to have herd immunity?
At what point do we have herd immunity? What percentage of our population?
Between 60 and 70% of the population. That would be the ideal situation. But as I said, the least amount of people you have sick, that's how the infection rate goes down.
I think there's just some information that I was trying to get for you. Let me see if it has come. No, it's not available. Dr. Ford is in another meeting and is unable to join us, but he will come on a future occasion. But in any event, Dr. Best has confirmed that there are children and young people who have become ill, although he cannot say today how many of persons, younger persons, are in isolation. Dr. Ford is in charge of isolation facilities and in Barbados and would be able to give that number. So we come to the end of this press conference, which has treated to the matter of the rollout of the COVID vaccine. More information is going to be coming your way shortly in various formats so that there is absolute clarity. We know that we are starting with the front line workers and the military and paramilitary, the Royal Barbados Police Force, the Defense Force, those who have been helping to hold this country together. We will move then to healthcare professionals, healthcare workers, persons in healthcare institutions such as the Queen Elizabeth Hospital. Then there are other frontline workers to be considered and included: gasoline station attendants, supermarket workers, and various other categories of individuals who work so hard and are so exposed because they have to be there to serve and service our needs. We continue the battle to beat back COVID-19 in Barbados. But now we have an additional weapon. We have the Oxford AstraZeneca vaccine, 100,000 doses. And the vaccination program starts tomorrow. Until we can get vaccinated, you and I, our best weapons and lines of defense remain. Wearing our masks properly so that they cover our noses, mouths, and chins. Washing our hands often with soap and water, and where soap and water are unavailable, using sanitizer, staying 6 feet away from those who are strangers, and exercising care and even wearing masks around the elderly, around those who have chronic non-communicable diseases, and members of our own household. Staying at home so that we are not exposed and that we do not pick it up from anyone, take it back home to relatives and loved ones. There's still a lot of reports of people out at the beach in huge numbers, clumped together in groups, of people at bread vans, all up close, and we have to take responsibility for our actions. We have to take responsibility for our communities and for our country. We have to take responsibility for ourselves. The government is doing its part. Every single one of us must do our part. And so until the next press conference to keep you updated, I wish you well. I wish you good evening, and I ask you to consider all of the information so that you make the decision to get vaccinated. You, for your own protection, for the protection of your loved ones, and for the protection of all Barbadians, and so that we can get our economy fully open again. And the economy is not about protecting the economy for the economy's sake. It is about ensuring that all of us can live comfortably, can earn, can pay our bills, can have resources to meet our needs. That is what protecting the economy or ensuring a vibrant economy is about. Let us all join hands in this battle as Barbadians to ensure that we beat back COVID-19. Good evening to you.
Hey boo, I could come by you. We ain't see one another in days, and I could really do with a little company.
You for real? Come by who? The country pump pause, and I putting you pump pause too.
But you know me, boo. Come on, man. Well, it's just one time, once you're breaking curfew.
One time is too much time for COVID to get in at me and harm me and my family. This is how I see it. Wear your mask, sanitize, respect the curfew, and keep your distance now, so that we could be together later after we beat this pandemic. So let me do like Uncle Barris and feel love from a distance. Ooh!
Stop the spread. Simple so. A message from the Ministry of Health and the COVID-19 Communications Unit.